Good morning. My name is Dr. Hillel Mazansky, and I'm a board certified physician in 3 countries, specializing now in medical hypnosis, guided imagery, nutrition, and exercise. My mantra being if the mind causes it, the mind can help treat or cure it using the 4 modalities that I mentioned. Today, we are going to discuss how medical hypnosis, guided imagery can assist you, can empower you to help yourself with your sexual and quasi-sexual issues. There are quite a few, so we'll be as brief as possible. Firstly, childbirth. Those females who wish to deliver their babies normally, we empower them to have a relatively painless childbirth. In a previous life, having delivered many babies and had done many cesarean sections, I encourage you all to try and have a normal childbirth. By doing that, the chances of you increasing your chances of increased breastfeeding and nursing is increased. By nursing, we will discuss that later. It also has its positive effects. You study the medical hypnosis recorded interview twice a day for a few weeks prior to the childbirth, and you will be amazed at how little pain you really have. The next is lactation, breastfeeding, or nursing. Using medical hypnosis, we can increase the chances of you nursing successfully. We are really passionate about females nursing for 2 reasons. One, the chances of your developing breast cancer are far reduced. And secondly, the chances of your child developing childhood obesity are also reduced. The tremendous bonding that takes place between a female and her newborn child who she nurses is not the same as the bonding between a mother and a child where the child is nursed. Thirdly, PMS or premenstrual syndrome. 85% of American females suffer from PMS. 5 days prior to their menstrual period, they begin with all their symptoms of bloating, constipation, and psychological issues, which respond extremely well to medical hypnosis. We are able to reduce the stress and the anxiety that is associated therewith. Postmenopausal syndrome or hot flashes. We are able to, through the use of medical hypnosis, increase the hormonal production of the female and lessening all her symptoms of the hot flashes, etc. Erectile dysfunction is a problem not only amongst the older generation, but also amongst the younger generation. The vast majority of those who are younger who suffer erectile dysfunction have psychological issues, which are explored under deep hypnosis. Methods to attain an erection are also discussed. Females who have difficulty with reaching climax. This treatment of medical hypnosis and guided imagery works extremely well. I do not know of any other holistic treatment that can function as well. We, of course, do not encourage patients suffering from hot flashes or postmenopausal syndrome to take hormones because they are deleterious to their health. Another issue is of male and female infertility. Why wait, spending hundreds of thousands of dollars of treatment when undergoing 1 or maximum 2 sessions of medical hypnosis will empower males and females to assist themselves in being parents and the female becoming pregnant. There are also other issues that can respond to medical hypnosis and guided imagery that are of a sexual or quasi-sexual nature, but we do not want to delve too long into all the indications because of a matter of time constraints. Suffice it to say that every one of those patients who we see in consultation also receives a nutritious program specifically designed to their condition, because we are aware that there are certain foods that one can eat that assists them with their issues. We encourage cardiovascular exercise to increase the pulse rate. By so doing, the endorphins or the feel-good hormones are released, and stress, anxiety, and tension about their personal issues are also released. For further information, you are invited to visit my website at www.gianinc.com. I'm not sure whether I mentioned, but we are now doing in increasing amounts of telephonic consultations. Medical hypnosis, guided imagery, nutrition, and exercise can just as well be handled telephonically as if you were sitting here. I thank you for your attention.